From Medskl.com, I'm Dr. Sanjay Sharma, and welcome to If I Knew Then, a show that's based on a very simple premise, that when everything is said and done, life comes down to a few key moments and decisions. We're thrilled to have Dr. Doug Angel from Memorial University on the line with us. Welcome to the show, Doug.
Thank you. Thank you very much for having me.
Now, the Rock is definitely one of my favorite places. As a former maritimer, and so the way we typically start the show off is just going back to when it all started. So maybe you can just walk me through. I'm assuming you grew up on the Rock. So tell me what it was like growing up there, and maybe just highlight a couple of key things that were important for you in terms of early influences for who you are today.
Yeah, again, thanks so much for having me on this show. I think it's awesome. I grew up in St. John's, Newfoundland. Actually born in St. John's, grew up my first few years in a small little town outside of St. John's called Torbay. But most people would still say I'm from St. John's. Born and raised here my whole life. I went to a high school here in town in St. John's. And a lot of my upbringing was geared around the music community, actually, along with some sporting and other things. But I've always been actively involved with the music community from a very, very young age, even as young as 3, 4, 5 years old.
Wow.
Whether it be choir or solo music or musical theater, these types of things, it was a big thing for me. And so that was something that my parents were very, very supportive of and had very positively encouraged throughout my upbringing, I guess, right through till university, actually. And so I grew up here, and when I think back, that's a lot of what I can remember is a lot of positive family and personal and friendship experiences associated with that part of my life that I guess kind of has a lot to do with where I am today, anyways, I suppose.
And because music has been so influential in your life, just kind of walk me through what I've got kids, and they're both quite interested in art, and I'm always wondering about the nurture versus nature argument, right? So on the music side, was it something that you were exposed to at an early age from your parents, or is it more something that was internally driven, I guess?
What's funny is within my direct family, neither my mother or father were musicians themselves. They love music, but they didn't play any instruments, nor do anyone in my direct family, any first degree relative, which is kind of interesting.
Yeah, it is.
My parents, or at least, my mother was somebody who's, very influential in putting me in music at a very young age. And I think some of the teachers kind of gravitated towards a talent there, I suppose, and we kind of went with it. So I think a lot of it would be, more nurture, I suppose, than nature, because certainly in my direct, lineage of family members, there's not anybody who plays themselves. Now, my mom's father, my grandfather, is somebody who knows music extremely well, and my brother knows music extremely well. They can listen and critique and comment, but in terms of the actual, technical ability, nobody in my, immediate family is really taken in the same way that I have. Not to sound overly successful, but that's just the way it is, I suppose.
Yeah, no, interesting. and was it piano, or was it a certain instrument that you, like, from a really early age you moved into, or take me through that?
It was so certainly was piano. Yeah, primarily piano, and piano alone, that I started with as young as the age of 4, I believe, or 4 or 5 years old. I started private lessons shortly thereafter at the age of 5 and 6, and I took piano as a solo instrument right through till probably 11 or 12, and then I joined a fairly successful youth choir here in Newfoundland that's still extremely successful worldwide. They just completed a tour from South Africa. They're called Shalloway nowadays, but previously they were known as the Newfoundland Symphony Youth Choir. So I started singing with them at the age of probably 11, and continue with that throughout, my junior high and high school days, along with the piano thing. And then right through to university, started singing with a group called Quintessential Vocal Ensemble. Newfoundland is very rich with, we have a lot of concentrated talent on this island. I find so that's kind of where I took off with from a musicality standpoint.
Yeah, no, it's interesting. I mean, it's funny because growing up on the East Coast, I used to play in punk bands and things like that, and so I mean, there's got to be something being close to the water and the air, that makes people.
Yeah,
really,
there's something.
Yeah, for sure. Now, okay, so you're pretty concentrated on music, and then so let's go through high school. So, I mean, when did the kind of medicine bug sort of get to you, and was that a difficult choice to make, or what was going through your head, I guess, as a grade 12 student, and what was your next move at that point?
Sure. So I can remember, I can visualize as being a junior high student in my parents' family room, the house they still live in, actually. And I remember watching these shows on TLC, which I think was a channel, and it was, shows kind of related to surgery, and they show these wonderful stories of, children having these operations done. So even from that level, time, I remember being quite fascinated with surgery as a whole. I actually got a snowball to my eye in grade 7, funny enough, and I had to see an ophthalmologist here in town. And I remember being fascinated with all the tests they did at the time to look at it, small hemorrhage of sorts, nothing serious. And I remember my parents still say that day I came home from that appointment and I said, I'm going to be an eye surgeon to my parents when I was in grade 8. And I've always been kind of fascinated with these types of shows. So anyways, fast forward to high school. My father was also a physician. He's a psychiatrist. So I was accustomed to that, lifestyle from a family perspective and work perspective. And I was always interested in medicine as a whole, not particularly sure what area. But at the same time, I was also so involved with the music community, and things have been going so well that I just pushed through with that. And did some AP science courses just because I kind of had it in the back of my mind that I wanted to do a medical field of some sort. Not, 100% sure that I wanted to do that, but I always, had that in the back of my mind, but continued pushing through with the music side of things. I went to a high school in a very, very good music program called Holy Heart of Mary. At the time, Susan Quinn was the music director there, and she ran the choir, and she was very, very supportive of, succeeding in music as a ways to also enhance your career in other ways. And that was, back in 1997, 1998. She was a big influence at that point in time to go through with the music thing as opposed to, barreling through with the science degree just for the sake of wanting to get into medicine. So, yeah. Not sure if that answers the question. I kind of veered off a little bit more.
That's perfect. That's perfect. Okay, so then you went to Memorial for your undergrad?
Correct. Yeah,
okay.
Undergraduate degree.
And at that point, you're doing both science, or you're doing music as well, or was it a combined degree, or what did that look like?
No, it was so. Yeah, I applied. So I consider this a lot in grade 11, knowing that I thought I wanted to do medicine as the ultimate career choice, but things were really going well in the music. I was touring a little bit, not touring, so to speak, but traveling, doing competitions and doing fairly well. And, I didn't feel that it was something that I wanted to completely give up simply for the sake of getting into medical school. So I applied for music and said, I'll deal with, if things go well, that's great. If I still want to do medical school, I'll deal with that in 3-4 years' time when it comes to it. So I applied to music school at Memorial for piano performance, or classical piano performance at the time. And was accepted and started there in, I guess it would have been September of the year 2000.
Interesting.
And so I did a four-year degree, or we condensed it down to about 3.5 years in classical piano performance.
Wow.
So bachelor of music. But that's what I did. There was no science there. I took some science courses on the side just to supplement my studying for the MCAT at the time, but
Yeah.
there were no formal science courses taken.
Now that, I mean, obviously that's a pretty atypical route, right? Is that fair to say? I mean, like in my med school class, you would have definitely been, 1 in 100 sort of thing.
100%. I think it was certainly atypical then. It's probably atypical now. It may be a little less so than it was when I applied in the year, I guess, 2003 or 2002.
Okay.
But certainly an atypical route to go for sure. Yeah.
Right. Right. And okay, so then you're in undergrad. You make that decision.
Mm-hmm.
The kind of the drum beat is getting louder and louder to apply to medical school, I guess, towards the end of the your undergrad, and you get in, and then do you feel disadvantaged because you weren't in a hard sort of science program, or I mean, take me through kind of the first year of medical school.
So sure, yeah, that's if you look at it on paper, it's obviously going to seem like you'd be very disadvantaged. And I had to be honest when I started medical school. As most medical students know, or anybody who's gone through this, you're bombarded in your first year or even your first term with very, scientific and very science-oriented things, whether it's, biochemistry, organic chemistry, the genetics side of things. So the first term was very overwhelming, I found, from a knowledge standpoint, because again, I had not taken a single science course in undergrad. Memorial was a lot of the prerequisites for other medical schools require that you do science courses as prerequisites. Memorial did not have that. Their only prerequisite from a undergraduate standpoint was an English degree, actually.
That's really
and the MCAT obviously required you to do science. You couldn't get in without writing the MCAT, so you had to know at least some sort of basic knowledge. But they didn't have science courses as a prerequisite. Regardless, the first couple of months were very, very overwhelming. The interesting thing I found about coming from a music background and a music school background is, music students are, from a Newfoundland perspective, to use a Newfoundland term, are run ragged, right? So they're in several different places all day long. The day goes from 8 a.m. in the morning till 10 o'clock at night. And you may have a few hours, but from a time management perspective and knowing how to focus when you need to focus for an hour, that really, I think, helped get through those first couple of months, 3 months, 4 months, where things were, exceptionally overwhelming for me, when they probably weren't so much for somebody who had come from, say, a biochemistry degree.
Right. And I'd be interested to know, given everything that you did in the music world, the skills that you acquired there, do you see them as beneficial for a medical degree and ultimately for a physician?
I do, yeah. Oh, this is obviously a somewhat passionate area for me. I've talked about this a little bit, initially just in social circles at a meeting when we're out having a beer after a lecture, to now giving, a few formal lectures that, I was in Vancouver in May, talking about, the similarities and things that we can learn from the music culture and the medicine culture. So, I certainly think there's a lot of similarities there that are things that we probably didn't realize. And it's been something that I've, taken some time to self-reflect upon, actually, and think about. I could get into them, certainly the time management side of things is something that music students deal with on a daily basis, because, there's lectures in the morning, there's practices at, rehearsals at lunch, there's a, private study, there's things in the evening, there's a variety of different things, happening. I can certainly speak to the certain things about surgery itself that I use on a daily basis, or at least I've realized I use on a daily basis, that I didn't realize I did until I actually did these lectures and had to go back and take some time to kind of self-reflect, right?
Yeah, but it's interesting you say that. I mean, it's funny, like, because I'm writing a whole series, and that's going out on LinkedIn and a few other areas, and it's not until you actually do this self-reflection and deconstruct a lot of things in your past life that you realize. I mean, I just wrote something how, I played a fair bit of tennis, and we were talking a little bit earlier about playing tennis, and I came to it, as a 12-year-old, and I literally played, for 10 hours a day against a board. And it's like, you think about the skills and, early on in your surgical career. I mean, I used to literally buy cow eyes and work on cows, or we go to the butcher on a Saturday morning and buy these eyes.
I did the same thing. Yeah.
Yeah. And it's, once you start to get to the podium and are asked to reflect upon things, you start to realize, there's incredible lessons that I've learned along the way, whether it's playing in a band or whether it's through sport that really are just incredibly invaluable lessons for your medical career and being a physician. So I'm interested to know just a little bit more. You talked about in the operating room. So take me through how you think music has made you a better surgeon, for instance.
So yeah, I've got a number of things I could talk about. One thing that I think is, having come from a fairly intense surgical training program and surgical fellowship, that we don't necessarily talk and address enough in teaching nowadays, is this whole concept of deliberate practice. So it's talked about in sports, in music, and I think we do to an extent do this in medicine and surgery, whether it be, the medical or surgical side of things, but I don't think it's enforced, or at least it's not emphasized enough. So deliberate practice in medicine, or in music, what we talk about is, the simple fact of repeating a task endlessly without, constant evaluation and appraisal of what happened is not going to, lead to improvement, right? So my concern, sometimes having, dealt with many surgical residents, is that a lot of times some people feel that if you just simply repeat, the simple fact of being there and repeating and repeating and repeating is going to lead to improvements, is an excellence, however you want to put it, competency, to use a term that's relevant. I don't think it's going to get you there. So in music, deliberate practice, if you take one phrase or one bar or one page or one movement, would involve doing that and then essentially going back and self-reflecting and self-evaluating every single part of that. What you did wrong, what you did okay, what you did great, what we could have done better, and going back and doing it again to try to, take a step up on that. And, certainly we do that in surgery, but we don't necessarily make concrete efforts to focus on that. So that's one thing. And, I think I do that even nowadays sometimes. If, I do a neck dissection and it goes great, I often ask, why did it go so great, And there's certain small steps that happen and, that would lead to that being that much more efficient or elegant, or however you want to put it. So I think deliberate practice would be one thing that's talked about in the music world, the sporting world, that we maybe don't talk about in surgery enough. That's one thing.
Yeah, no, and I think that, that's very topical because, I'm sure you've heard or seen Malcolm Gladwell's book on, 10,000 hours to sort of be an expert. And there's now two camps. Like, some people are saying, well, there's 10,000 hours, but then there's another camp that says you can probably get there a lot faster through deliberate practice. And, I think in the kind of sports world, we go through visualization. And again,
Correct.
I remember as an early cataract surgeon, I'd be swimming, I'd start my day early in the morning, like 5:30 in the morning, and I'd be swimming. And literally I would actually do like 5 or 10 cataract surgeries as I was swimming. So mentally just going through visualizing, the 17 steps of that procedure that I had to do. And so, I think whether it's really doing or actually even just visualizing, in a deliberate way, I think that those are incredibly important skills for anything that you do.
Yeah, the visual mental practice, I can't emphasize. That's another thing, as a, musician at one point, prior to doing a big performance, you'd spend an hour outside in the backstage area going through that, every, bit in your head, so that you knew when you got to those points mid-performance that you'd already rehearsed them mentally. And, as a surgeon who deals with occasionally very long 10, 12, 14-hour cases sometimes from, head and neck cancer perspective, I don't visualize every single second. Some of it becomes muscle memory and you just do it and that's fine. But those trouble points or those pivot points, which is reflected in music as well, I focus on those sometimes, and knowing what when I get to those particular places. Something that I do, but I didn't realize I did it until, again, I went back and had that period of self-reflection.
Perfect. Now, one of the medical school students is piping in here, and they want me to ask you about, obviously you're incredibly committed to music, and now we're going to move into your residency specifically. I mean, how did you manage, keeping that passion still alive for music, A, during medical school and B, during residency? Because I know, both of those, that 10 or 12-year period, is pretty grueling times. And so just any practical tips for A, how you did it, and maybe for how medical students can, and residents can sort of keep their passions going during that time.
Yeah, I guess for me, maybe I'm unique, but I found a way to kind of compartmentalize things. So there was the medicine, and that was obviously my priority and always has been from a professional standpoint. Even back to music school, but in music school, I played with a rock and roll band. So I was kind of done with the classical music side of things, but I still play with a rock and roll band all through medical school. And it was, for me, it was just, that was my way of kind of decompressing outside of school. We played actually in our first year of medical school. I played every Tuesday night at an open mic night at a bar called O'Reilly's, till 1 a.m. Then we got up early the next morning and went to school. And it was just one of those things. I was a little bit, tired, but it was just one of those things that was, this was an out for me. And it was a way to kind of separate, medical school and music from that regard. And I just made a conscious effort to do that. Like I never said no. And maybe that's I don't know, it could be a fault, I suppose, but I never said no to playing a music gig. I said, I'll just say yes, and whatever's happening, I'll deal with it later. And it always comes down to time management, I think, to some extent, because if I knew if I had a gig coming up, then I'd have to do more work before then. So by the time the gig came around, I needed that period, then it was done. So I guess in a way, it kind of forced me to manage my time a little better. In residency was busier than medical school was for me. I went to Western University in London, Ontario, which was awesome, and I loved every bit of it. But it was busy. I did a few small little music things there, and that was mainly geared around fundraisers organized by the medical community that knew that I had a passion in this. But I'd often fly home frequently. In my first couple of years there, every 6 weeks I flew home and did a gig with my old group of people, even for a weekend, fly home on a Friday night, play a Friday night, Saturday, and fly back on Sunday. And it was, again, I think, not to sound, to preach, but it's just something that you just, for me or for other, medical students, residents, I just think it's something you're passionate about, you just do it because it's going to keep you healthy and sane, and, do the work, front load the work, do that work before you have these things coming on. And that way it's done and dealt with. And that's just, it's me. It's a personal thing, I suppose, but it may not apply to everybody, but that's just what I did.
What was the name of your band?
In 2003 to 2008, we were called the Insiders. Yeah, we were a classic rock band. We played a lot of covers. We had 5 or 6 of our own.
Like the Stones kind of stuff, or what?
Yeah, Stones, Beatles, Blue Rodeo, Tom Petty.
It's good stuff.
That genre of music for sure. And I can't take credit for writing anything. I was kind of there to help with some of the instrumental side of things. But
I was in a band called Urethra and the Ureters, and we did Aretha Franklin covers. So it was it's funny what you get roped into for medical variety night, right? So now you touched on something that was quite interesting. So time management, like that's I think a crucial skill that medical students have to master early on. You've obviously done a great job on that. So you talked a little bit about compartmentalizing, but is there some strategies that you think are really important that you can reflect on? Do you schedule things on a daily basis, or how do you look at that?
Yeah, I think that's probably the most important thing, is setting a schedule, and abiding by that. So I do recall, going to the medical school library, and we would we're going to study from 7 till 9:30 And once 9:30 comes, then that's it. In that way, at least, again, this is a personal thing for me. You're not going to say, okay, I haven't done this, this, and this. I'm going to stay till 10:30. I don't particularly think that's always going to be productive or beneficial. But if you're getting there at 7 and you're done at 9:30, coffee break for 15 minutes in between, that's what we would often do. When I say we, I say a couple of close friends of mine who I studied with, even in first year, second year medical school. And when 9:30 was done, we were done, or 10:30, whatever it may be. And I think kind of setting that, time frame or time limit, whatever it may be, can be really helpful. And know that when you start at 7, that when 9:30 comes, that's it, it's done. So you need to get done what you need to get done. I'm a big believer in, endless and countless hours are not necessarily productive, or they can be, I shouldn't say that, but I find short bursts of things, an hour at a time and a break an hour at a time, can be much more productive than, dragging something out for a whole Saturday. And that's just always the way I've been. Again, it's a personal thing, but I certainly know many colleagues who are of the same mindset.
Yeah, no, I agree 100% on that. Okay, so now walk me through. So you're doing a great job in at Memorial University, and what was it about ENT that really pulled you into that direction?
So I guess when I started medical school, even before then, I always had quite a fairly passionate interest in surgery. I'm not sure why that may be. People always say it was because of the manual dexterity or the use of your hands for music. To be honest, I'm not really sure where it comes from. It's just something that was innate, I guess. So I've always had an interest in surgery as a whole. And even from my first year, I do recall shadowing with one of my mentors at the time. His name was Ken Burridge, who I actually just finished in the OR with about 2 hours ago. Now my colleague, but he was my mentor even as a first year medical student, who's a head and neck surgeon. And I just happened to sign up and shadow early September, October, my first year medical school. And he was just so energetic and happy and just passionate about his job that it was just very, I guess it just wore off of me incredibly. It was something that just stuck with me. So that surgery, or that particular part of surgery, the head and neck side of things, really just stuck with me. I continued through, and then I also had an interest in oncology, so cancer sorts, and the two just kind of, seamlessly met, to be honest with you. So head and neck oncology seemed to be something that just kind of took off. And I had to be honest, it wasn't some, eureka moment where I said, oh, I want to be an ear, nose, and throat surgeon. It was more of something that just kind of happened, having worked with people who I saw them, how passionate they were about what they did and how they had a great time in the OR. They laughed and took things seriously, but also had a light side of things that I just kind of slowly said, I want to be like these guys. That was what I said in first and second year medical school. And I just stuck with it. And here I am. I just did 3 thyroidectomies with Ken Burridge, who was my mentor, 15, 16 years ago. So
and it is extremely interesting just how, exposure to really dynamic people at that point in your life can, totally change your career direction. Right. So, one thing that I think a lot about too is, sometimes you don't want the medical students to be too influenced by just a dynamic, personality, right? So, it's more of a comment, I guess, than anything else. Obviously, you're so passionate about what you're doing. You get to do, thyroidectomies and a lot of oncology. Now take me through kind of what your day looks like on a regular basis, or is every day a little bit different?
Every day is a bit different, but every week is about the same, if that makes sense. So my days are, day to day, Monday to Friday are a little bit different, but my weeks are usually the same. I'm usually in the operating room on a Monday and a Thursday. I work out of our provincial cancer center on Tuesdays. And we also have an office outside of the hospital that there's 8 otolaryngologists or ear, nose, and throat surgeons in St. John's. We all have different subspecialty areas, but we all run our office out of the same building. So then I usually am here on Tuesday afternoons and Wednesday mornings. I do a small procedures clinic at our hospital on Wednesday afternoon. So little skin cancers, lumps and bumps, biopsies of, oral lesions, that kind of thing on Wednesdays. I'm in the OR Thursday, and then every second Friday I'm in the OR as well. And then every other second Friday, I usually just do a half-day clinic and take the afternoon off if the opportunity is there.
Great.
Yeah.
And so you're kind of got another balance too, in the sense of you've got your clinical practice. You're through Memorial University. You're also associated with the undergraduate medical education, so that's probably a pretty significant responsibility for you. And then you also do some research as well. Is that kind of a structured thing, or more of as an ad hoc thing?
More of an ad hoc thing. So I'm not I'm not in a GFT type position. I'm a clinical assistant professor, but I really am passionate about the undergraduate medical education stuff. So I'm kind of our Canadian Society of Otolaryngologists. We have a provincial not a provincial, but a university representative for ENT at the undergraduate level. So I'm that particular person for our university, and we've been really trying to push at least our subspecialty a little more into the medical school world. So we've kind of our group as a whole, national group, have helped come up with objectives and push to get more face time with the medical students at an undergrad level. So actually we've increased our lectures from 0 hours to 9 hours.
Awesome. That's wonderful.
At a PGY, as a medical school 1 level. So I do all those lectures, and I love it, actually, to be honest with you. I really enjoy teaching at that level. So that's a big area of mine, and I collaborate on a number of projects that happen across the country, nationwide studies. I'll be honest, I'm not doing the legwork myself. But my other area is the music and medicine thing, where I've certainly I've seen a number of people write about this and that kind of thing. I don't have research responsibilities, so to speak, and I've always been one that's more, I guess, in tune with the teaching side of things, as opposed to being a primary researcher myself.
Right.
But I'm happy and love to collaborate with all the smart people across the country.
Sure. Well, there's a lot of them, that's for sure. Just picking up on a concept on there's been a movement in a lot of medical schools, particularly in Harvard, and I think at McMaster, to infuse art into the curriculum. And so I think that's more, what I've seen at least as more visual art appreciation, because there's a sense that, if you can tell the difference between a Picasso and a Rembrandt and a Basquiat, that you can probably help your diagnostic making process. And so I'm kind of interested to know, on the auditory or musical side, where you're kind of going with music. Is it kind of improve diagnostic ability, or is it kind of relaxation in the operating room to reduce surgical errors, or something totally different?
That's a good question. I didn't know about that. I'd have to look into a little more about that.
Yeah.
That's interesting. From a music perspective, I guess there's two different levels or two sides. So it's certainly music in the operating room. There's actually some objective evidence to suggest that can improve and lower surgical error. There's a great study, I think it was done in Europe. I can't recall off the top of my head now because it's a while since I looked at it, but it was a surgical simulations lab, and they looked at early junior residents, senior residents, and staff surgeons doing a laparoscopic cholecystectomy in a surgical simulators, which we know now are very, very realistic, in 4 different settings. 1, no music, 2, discordant music, where they'd play one song in one ear and another song in the other ear, 3 with rock music, and 4 with the Mozart sonata, and looking at errors and surgical time deficiency. And consistently across the board, with a significant p-value, they showed that listening to a Mozart sonata proved to be the most
interesting.
Yeah, it's a great little paper. So I can't recall the details. I'm sure we can get it later. So that's one side of things. So I always listen to music in the OR. From a diagnostic or what kind of thing, I think any person who's involved with the arts, as we all know, there's a certain artistic side to medicine, and whether it's painting or music or whatever it may be, literature, I certainly think there's just a different philosophy behind the teaching there, and there's a little more malleability, if that makes sense, as opposed to, medicine traditionally is very structured and rigid, and I think we're getting away from that. But I certainly think that artistic side certainly can help with bending your mind a little bit to understand or maybe find certain particular problems or figure out problems that you wouldn't otherwise in a very rigid and structured world.
Right. Yeah. Now hopping back just to medical students, do you have any kind of tips for just success in medical school? Knowing what that you came in from maybe a bit of a different background, is there key things that you recommend just for surviving those 4 years? And then secondly, I know one of the medical students has just also asked me to ask you, what are some of the kind of important factors to consider when you're trying to make that decision to go into a certain residency?
So I guess part one, one thing that I always teach, because you always have people, we're all different personality types. So there's going to be people you don't necessarily get along, right? But I've always taught, whether it's a resident or medical student, that you can learn something from everybody, right? So I think that's really important, because you'll often come through, you do your psychiatry rotation. I knew when I went through psychiatry that I had zero interest in doing psychiatry. My father is a psychiatrist, funny enough, but maybe that's the reason I had no interest. But I respect him very much for what he does, and love him very much, obviously. But even in psychiatry, there's a lot of things you can learn from people, right? Even if you're going to be a hard-nosed surgeon or an internal medicine subspecialist, whatever it may be, I think there's something you can learn from everybody, from a physician standpoint, but also from nursing, from our multidisciplinary team, speech pathology, our nurse practitioners, our dietitians. There's something you can really learn from everybody. So even if you're not particularly interested in that, try to find a way to learn something from those people. That's one thing that I always teach, and humility too, because the minute you lose that humility, that's when, start to become complacent, that's when bad things happen. So I think those are things that I preach a little bit onto, or at least I try to teach a little bit, but I think they're important. Part two was to,
in terms of choosing a residency, is there, are there so like, when you were thinking about ENT, was there, specific variables that you were looking at? Is it a good fit, or just kind of walk us through that a little bit more?
So yeah, I guess there's a few things to consider. One, obviously, I think a lot of specialty or subspecialties have, you can't group everybody in the same box, but there's certainly personality types that fit into certain, subspecialties, whether you're a general surgeon, an ophthalmologist, an otolaryngologist, family medicine person, a psychiatrist. So not that everybody fits into that mold, but there certainly are, characteristics that veer people towards that. So, you can do some of your own self-reflection, I suppose, and see if that's something you fit into by meeting people who do that particular specialty. And I guess the one thing that, when people come through with our specialty, they often come through on the head and neck service, and they'll see these, big, 10, 12-hour cases where we do the, resection of a mandible and tongue cancer or buccal mucosa, fibula free flap. It's this big, it's crazy for people who haven't seen that before. But really, that's not the daily routine for an otolaryngologist. So I think it's important for people to know what that daily mundane routine is, and as long as they're happy with that, that's important, because I find a lot of, at least where I went to residency, a lot of the medical students come through and they see the crazy cases, even the endoscopic sinus surgery, the otology stuff. It's all very, tertiary care level things, but the majority of us are probably going to go into, or at least a good portion of people are going to go into community practice and stuff if it's a subspecialty. So it's important to be happy and comfortable with what the daily routine might be. I guess I'm not sure what else to.
Yeah,
Those
no,
are two things
those
I
are
can think
great
of.
great thoughts for sure. Now I'm interested to know, obviously, as a physician, you're kind of in the crucible, particularly as a surgeon, a lot of times, and you're delivering care, but you're interacting with people on the other end. And I'm always kind of fascinated the other side, the patients coming with information that, and we start to think and reflect a lot more about ourselves. And I'm wondering if you've, had any kind of thoughts about, a patient interaction that you had in medical school, or in residency, or as a clinician right now, that was kind of important in terms of changing you, or challenging, maybe some of your mental framework, or just you came out of it maybe just thinking a little bit differently.
Yeah, I think that probably happens fairly regularly on a, again, I don't have a big, at least off the top of my head, something that's not true. I do have this one moment as a first year medical student. I was in a small town called Roddickton in the northern part of Newfoundland, Northern Peninsula. And I had met a guy, his last name, I can't remember. I won't say it anyways, because we shouldn't do that. But he had a very extensive head and neck cancer. And he was, at this point, he'd been resected and radiated. And it was, at a point where things were no longer curable, so to speak, but they were still treatable. So you could, and I remember we were doing these home visits. So as a first year medical student, we would go in and visit these particular people's houses where they, and it was, I remember having a moment then where he just sat down and talked about how, great life was, and how quickly things can change. Because a lot of times with head and neck malignancies like this, things happen and change fairly quickly. And that's another, reason I had kind of gravitated, I think, towards the head and neck side of the world. But this was a lovely man from the Northern Peninsula who, brought us into his house. It was myself and a colleague of mine, Peter Collins, who's a pediatric anesthesiologist. We sat down with him, had a cup of coffee at his house, and he was having difficulty eating and drinking, obviously as a result of his cancer, and talked to us about how quickly things can change, and how not to, take things for granted. Again, it's cliche, but it's probably cliched for a reason, obviously. On the other side of things, I take, feedback from patients anytime. I think it's important, again, to keep that humility, because, maybe some of it's unwarranted and not fair, but I think we can learn a lot from our patients. And it's just sometimes people knowing that you're willing to listen to them, because they probably talk to people many times who just kind of, put them aside, and because the complaints are don't sound that worrisome. If you take that extra second and say, if there's one thing I can do for you today, what might that be? Sometimes people just need to be heard, I think.
Yeah, that's great. Yeah.
And so people make suggestions. I always try to do my best to listen, even if it can be frustrating sometimes, as we all know as medical professionals. Sometimes it's not necessarily warranted, but to take that extra step and that extra minute, and that's all it is, minute, 2 minutes, and listen to somebody, it can often make a world of difference, right?
Yeah. Couple of last couple of quick questions. Now, one of the medical students is also asking, is there a difference in terms of practicing between Ontario and Newfoundland?
That's speaking to, I would presume the medical students are from Ontario. Or
I'm assuming so.
There is, to an extent, it is a bit of a, and these are not just for medicine. This is for, I've got colleagues of mine, or colleagues, but friends of mine who are lawyers in Ontario, lawyers here, or engineers in other places. The pace a little slower, in Atlantic Canada in general. And I say that confidently because I have many, many friends in Atlantic Canada and in Ontario who say that. I don't necessarily think it's any different from a, how do I say this, work perspective in terms of what we deal with, whether it's a complexity level or a technical level surgically, or, the medical school level. It's just, I think it's the East Coast life where things tend to be a little slower paced. I don't think it's a bad thing. I don't think it's a good thing. It's just slightly different. But I would have been very happy working in London, Ontario. I would have been very happy working here. I kind of had my sights set on moving back here. My family's from here. My mom and dad are around the corner, and I love the culture. I love the music here, and that's more of again, a personal thing. But I wouldn't persuade anybody from going one way or the other at a medical school level, for sure. I respect and love Ontario, where I train. I would be happy working there if things didn't work out here.
Great. And one last question. Advice to your 25-year-old self?
I guess that's a really good question. I knew I was going to get asked that, and I always think about it and never know how to answer it, not to get
well. I mean, it's obviously worked out incredibly well for you. So, it's
there's just I think I was a little. You can become impatient with certain things, in certainly in the medical world, and unrightly so. Like I don't, I'd get frustrated with certain things even at a resident level, and at the time, I probably didn't realize that when things didn't appear to be going right and they appear to be going wrong, and you get frustrated, you're actually learning something at the same time and probably didn't realize it. And maybe some of the frustration sometimes probably negated a little bit from that. So, sometimes embracing the failures, I've got many at a resident level where you feel like you really did fail somebody, either a patient, yourself, or your mentor, your staff. Embrace them a little more, probably, because you can learn a lot from them, I think.
Well, that's wonderful advice, and it's really been a pleasure to be able to talk to you. It's always nice to talk to people who have accomplished so much, but be people who have come from different backgrounds, and obviously, coming from an arts and music, has really influenced your life and your career in a really tremendous way. So, once again, Dr. Angel, it's been a pleasure to talk, and I know the medical students, I'm speaking for them, have learned a lot from you.
Well, I appreciate you guys having me. It's an honor, to be honest with you, and obviously, want to relay my email address or that kind of thing. Happy to talk. So appreciate it very much. Thank you.
I appreciate that. So that's that's a wrap for this episode of If I Knew Then. Again, we had a wonderful conversation with Dr. Angel from Memorial University. If you like this show, just remember to like it, to subscribe to it. Just feel free to drop us a line. We're working on a number of episodes coming up in the next few weeks. So feel free just to drop us a line around questions that you want us to ask our next people that we'll be interviewing. Until then, hopefully we'll be doing a lot more live shows coming up in the next few weeks. So thanks so much for tuning in.